In the bustling city of Wuhan, China, during the waning days of 2019, a new and mysterious illness began to surface. Initially, it seemed like a typical respiratory illness, perhaps a severe form of the flu. Doctors treated patients with familiar remedies, but the illness spread with alarming speed. The virus, later identified as a novel coronavirus, had leaped from an unknown animal host to humans, sparking a chain reaction that would soon grip the world. The Huanan seafood wholesale market, a sprawling complex where live animals were also traded, quickly emerged as the epicenter of the outbreak. Health officials descended upon the market, shutting it down and collecting samples in a desperate attempt to identify the source of the virus and contain its spread. But it was already too late. The virus had silently begun its journey across the globe. As 2019 drew to a close, the world remained largely oblivious to the looming threat. The new year arrived, bringing with it hope and anticipation for the future. Little did we know that the world was on the precipice of a global health crisis unlike anything seen in a century. In the early weeks of 2020, the virus, now officially named SARS-CoV-2, began to spread beyond China's borders. International travelers, unaware that they carried the invisible threat, unknowingly transported the virus to new destinations. Cases began to pop up in Thailand, Japan, South Korea, and beyond. The world watched with a mix of curiosity and growing concern as the virus tightened its grip. The initial response to the outbreak was a patchwork of measures as countries grappled with the unknown. Some nations implemented travel restrictions, while others hesitated, fearing economic repercussions. The World Health Organization issued guidance and recommendations, but the world seemed ill-prepared for a pandemic of this magnitude. As the virus spread, so too did fear and uncertainty. Hospitals began to feel the strain, with healthcare workers on the front lines facing an unprecedented challenge. The virus spared no one, infecting young and old, rich and poor. The world was at war with an invisible enemy, and the battle had just begun. On March 11, 2020, the World Health Organization officially declared COVID-19 a pandemic. The announcement sent shockwaves around the globe, signaling a level of global health emergency not seen in generations. The virus, once a distant threat, had become an immediate and present danger touching every corner of the world. The declaration of a pandemic marked a turning point in the course of the outbreak. Governments around the world sprang into action, implementing unprecedented measures to curb the spread of the virus. Lockdowns were imposed, borders were closed, and daily life as we knew it ground to a halt. The world watched in disbelief as cities once teeming with life became eerily quiet. Schools and businesses closed their doors and public gatherings were banned. The airwaves were dominated by news of rising case numbers, overwhelmed hospitals, and a growing death toll. The world had entered uncharted territory and the future seemed uncertain. Section 4. Fighting back. Measures to control the unseen enemy. In the face of an unprecedented global health crisis, countries around the world implemented a range of measures to combat the spread of COVID-19. Lockdowns, once unthinkable, became the new normal, confining people to their homes and bringing social and economic activity to a standstill. Masks, once primarily worn by healthcare professionals, became ubiquitous, a visual reminder of the invisible threat we faced. Social distancing measures were implemented in public spaces, transforming the way we interacted with one another. Hand sanitizer dispensers became ubiquitous fixtures, and frequent hand washing became a matter of public health. The world adapted to a new reality, one defined by caution, vigilance, and a collective effort to protect ourselves and others. The measures, while disruptive and challenging, were necessary to slow the spread of the virus and prevent healthcare systems from being overwhelmed. As the world grappled with the immediate crisis, scientists raced against time to develop treatments, therapies, and, ultimately, a vaccine to protect against the deadly virus. Section 5. A global effort, scientific research and vaccine development. In the midst of the global pandemic, scientists around the world embarked on an unprecedented collaborative effort to understand and combat the novel coronavirus. Researchers worked tirelessly, sharing data and insights in a race against time to develop effective treatments, therapies, and ultimately a vaccine to protect against COVID-19. The scientific community rose to the challenge, making remarkable progress in record time. Researchers mapped the genetic code of the virus, identified potential drug targets, and developed diagnostic tests to track its spread. Clinical trials were launched to evaluate the efficacy of existing antiviral medications, and new therapies were explored. The development of vaccines, once a multi-year endeavor, progressed at an unprecedented pace. Pharmaceutical companies, research institutions, and governments poured resources into vaccine development, leveraging new technologies and collaborating in ways never seen before. The world watched with a mix of hope and anticipation as vaccine candidates advanced through clinical trials. Section 6. The virus evolves new variants and ongoing challenges. Just as the world began to breathe a collective sigh of relief with the arrival of effective vaccines, the COVID-19 virus continued to evolve, presenting new challenges in the fight against the global pandemic. New variants of the virus, each with its own unique mutations, emerged, some more transmissible than the original strain. The emergence of variants like Alpha, Beta, Gamma, Delta, and Omicron underscored the unpredictable nature of the virus and the need for continued vigilance. Some variants proved to be more resistant to existing vaccines, leading to breakthrough infections and raising concerns about waning immunity. The virus continued to adapt, reminding us that the pandemic was far from over. The emergence of new variants highlighted the need for ongoing genomic surveillance to track the evolution of the virus and adapt public health measures accordingly. It also underscored the importance of global vaccine equity, ensuring that vaccines reached all corners of the world to prevent the emergence and spread of new variants. The fight against COVID-19 had become a marathon, not a sprint, requiring adaptability, resilience, and a sustained global effort.